Welcome dear doctors to the class of Pediatrics. Myself Dr. Parv and we are discussing kids covery. The topic of discussion for today is pediatric infections. So in pediatric infections we are discussing about the bacterial tracheitis today. What is bacterial tracheitis? It's a pseudomembranous croup. Okay. So what is pseudomembranous croup? See, what happens is, as the name is suggesting, it is tracheitis. Okay, it's called as tracheitis. Now what do you mean by tracheitis? Tracheitis is inflammation of trachea. Okay, so what is tracheitis? So tracheitis means it's the inflammation of trachea which is going to happen. Now, inflammation of trachea is going to have a membrane deposition which is not a true membrane. It's just look like the membrane. So it's a pseudomembrane. It's what? It's a pseudomembrane. Okay, so it's a pseudomembranous croup which is going to be occurring whenever we call it as trachea. Okay. It's not a true croup. Let me just tell you, it's not a true croup because the true croup is having laryngotracheobronchitis. Laryngotracheobronchitis. Okay. So very simple to remember that bacterial tracheitis is a super infection of the trachea which is characterized by purulent tracheal secretions. There are going to be pus which will be coming out. Why? Because it's an inflammation, right? So there will be pus which is coming out from the tracheal infection, right? So basically pseudomembranous croup is just a super infection. Okay, so there is a tracheitis, that's inflammation of the trachea which is coming along with the infection as well. So what are the most common infections? So please remember, influenza is the most common infection that is responsible for causing tracheitis. Next comes the para-influenza and respiratory syncytial virus. Okay, respiratory syncytial virus as well. So just three things you have to remember, that you have got influenza, respiratory syncytial virus. These both are common in what? These both are common in pseudomembranous croup. Okay, clear? Okay. So nowadays girls are fond of using these words like creep. Okay, so creep and croup are very similar. So what is creep? I for influenza, R for RSV, and P for para-influenza. Okay, this is how you can remember very easily. And whenever girls are saying this word, that oh god, how creep, boys are resting in peace. R-I-N-P. What is R? Respiratory syncytial, I for influenza, P for para-influenza, which is there in the group. Coming on to what are the causative organisms. So I have told you what are the viral causes. Now we are discussing about the most common bacterial. Okay, and whenever there is inflammation, mostly the cause is Staph aureus. Okay, so Staph aureus, Staphylococcus aureus is the most common organism. The next common organism is Streptococcus pneumoniae, or you can remember the group A Streptococcus. Yes, Moraxella is also responsible for causing this. And if you guys don't know, just go and revise your microbiology. You will come to know that Streptococcus pneumoniae as well as your Haemophilus influenza, they are very similar in every kind. So please remember Staph aureus, Streptococcus pneumoniae, and then group A Streptococcus. These three are also sufficient to be remembered. So what happens in this case? See, there is an upper respiratory tract which is infected. So the baby is going to show the toxic appearance. That means the baby will show the appearance that the baby is not well. Okay, crying, feverish. So all these are toxic appearance. Okay, then dull face, just the toxic appearance. Okay, brassy and barking cough. So it's going to have a barking cough or a brass like. Okay, so whenever you take a metal of brass and you, so the sound which is going to occur, it's just a brassy, that kind of cough you will hear. Okay, so barking cough, just like the croup is having, similarly barking cough and toxic appearance is going to be there. Yes, the child is going to have high fever, hoarseness of voice. Stridor is also going to occur. Okay, stridor is also going to occur. So please remember, there is which kind of cough? There is barking cough, fever. Of course, it's a fever and stridor are the features. Whenever you see upper respiratory tract infection, these features are going to come only. So what is the pathophysiology? See, the mucus and the pseudomembrane obstruction is going to do what? It's going to do plugging of the airways, and this plugging of the airways is responsible for respiratory distress in case of children. Okay, and what investigation will you perform? You will insert a tube inside the larynx, that is a laryngo. Then you will insert the tube in the trachea, laryngobronchoscopy. Laryngotracheobronchoscopy is actually a diagnostic also, because there will be membrane which will be seen obstructing the pathway. And of course, what you can do, the excess amount of secretions which have been accumulated because the obstruction of that membrane, you can suck them out, you can aspirate them out. So there will be secretions, okay, secretions will be aspirated, membranes will be stripped off, right, and then the specimen can be obtained from the endoscopy, can be sent for the culture, for the gram staining, alright. And what is going to happen, you will do the culture and everything, gram stain and everything you will do. So what is the differential diagnosis? See, bacterial tracheitis as well as epiglottitis, both of them are going to show what? They are going to show you the toxic appearance. But what happens is, see, the tracheitis is not going to involve the epiglottis, first thing. Second, since the epiglottis is involved in epiglottitis, okay, since the epiglottis is involved, so epiglottis is involved, epiglottis fails to open, and that's why the accumulated secretions does not go inside the, so epiglottis, what I'm trying to tell you is, like, epiglottis is inflamed. So if the epiglottis is inflamed, it is going to do what? It is, it is unsuccessful to cover the trachea while swallowing. That's why the child doesn't swallow, and there will be accumulation of secretions, okay. So please understand, there should be, in bacterial tracheitis, there is no drooling, whereas in epiglottitis, the drooling is going to be there. And let me ask you one question. Which sign on lateral chest x-ray, you will see if the child is suffering from epiglottitis? If the child is suffering from epiglottitis, what is the sign you will see on the lateral chest x-ray? So if the respiratory infection is not treated, it can cause respiratory distress syndrome, it can cause pulmonary edema, it can cause pneumothorax, okay, it can cause hypotension also. So all these things can occur. Now you will give vancomycin, clindamycin, third generation cephalosporin, ampicillin, sulbactam. So these are the antibiotics which are given for the respiratory distress in the children, because see, vancomycin and everything are actually given for MRSA. So Staph aureus is actually involved now. I've told you already that staph and strep are involved. So vancomycin is given in that case. Clindamycin, cephalosporins are both starting from C. So Croup, okay, you can remember starting from C, okay. And of course, this ampicillin and sulbactam is important, okay, to remember, okay. So vancomycin, clindamycin, cephalosporin, and ampicillin plus sulbactam. So let's just quickly revise. 3 to 5 year of child, barking cough, fever, stridor, looks similar to croup, looks similar to epiglottitis, but it is not. Okay. So what you will do, it's an airway emergency. So what we have to do? We have to do airway management, give airway from outside, give IV antibiotics, fluids, and do the bronchoscopy. Okay, so this is all about the tracheitis. Thank you so much, and we'll see you in the next video.